Yeah, just thank you so much for having us, and it's so cool to hear from the other projects as well. So our project was called From Community Voice to Policy Change, co-creating violence reduction research in London. So this was all about, I guess, thinking about how we at the Violence Reduction Unit commission research and think about evidence creation. And I'll just today share a bit of the journey that we've been on over the last couple of months. So if you are unaware of the work of the Violence Reduction Unit, we were set up by the Mayor in 2019 to tackle rising levels of violence across the city. We have a public health approach to violence reduction, which means that we take kind of evidence, research, and insight to inform our approach and are constantly evaluating and iterating on our programs, but also that we work at the really early intervention prevention stage, largely with children and young people. So we have programs across kind of early years and families, education, schools. We do lots of youth work, lots of positive opportunities for young people, and then working with community groups, particularly in areas across the capital that are most affected by violence. And in terms of my role, my team sits on the kind of research and evaluation side. And so we commission research projects in kind of emerging or high priority areas. And so today I want to talk a bit about the problem. So we find from our research experience that there's often this disconnect between the community's experience and then maybe some of the research and evidence that's produced, particularly in the violence reduction space, and then how we use this project to kind of test some solutions. So integrating frontline expertise into the development of our research, recognizing the power dynamics that are kind of inherent in community research, thinking about the capacity within the wider system, and also embedding community and youth voice kind of like as an integral part of the research piece. And then I'll talk a bit about the outputs that are coming. In terms of the problem, I think research in the violence reduction space in particular, particularly violence impacting young people, can often feel really extractive, and can also often have like condescending language attached to it. So historically, a lot of the terms used to describe young people impacted by violence, it's kind of serious youth violence, high harm offenders, high risk victims, perpetrators, hard to reach, or like kind of gang technology, which is often like problematic or racialized. So when we were doing some scoping in this space about a new research project that we had some funding for, we wanted to really think about how we do this. I was really struck by this report by Chicago Beyond, which you can see on the screen, which is kind of provocatively called Why Am I Always Researched? And that really speaks to the decades of researchers coming into their community, having these really in-depth, quite traumatic interviews with young people, and then ultimately like nothing changing in that community. Closer to home, there's also this really great blog from Centric, which is a South London-based research community organisation that pulls out kind of extractive models of research, but also how involving communities from the get-go can be really empowering and add that nuance. So we kind of wanted to make sure that that's what we were doing. I'm going to talk about the event we ran, bringing practitioners, grassroots, and researchers together. But we asked kind of grassroots organisations, what is some of the harm you've seen in research? And some of the feedback was really like profound. You'll see on the left-hand side of the screen, they felt it was self-serving. They felt that the research often broke trust with communities or just preserved power in those that already held power. So clearly there's this kind of like mismatch between like what we want to do and how and the tools we had to do it. In terms of the actual research projects, so as I said, we kind of work across the spectrum from very early intervention to those young people who are already impacted by violence reduction or by violence and exploitation. And in public health violence reduction world, we call those tertiary interventions. So we had this pot of money to do research looking at the experience of young people who are already impacted by violence and how effective tertiary interventions are in London. And the kind of key things that we wanted to do in this research was understand what is already happening, look at the lived experience of young people within this, so not kind of focusing more on the systems and services and how they adapt to the needs of the young people rather than the young people themselves, understanding how the services could be improved, and also really thinking about in tertiary interventions, we know that relationships are really important, but really understanding what are the types and the mechanisms and sustainable relationships that are needed. So ultimately, we wanted to make sure it was really community-led research. I think we all agree in this room that evidence is really important, but ultimately it matters how it gets made. We at the Violence Reduction Unit see ourselves as a bit of an incubator. We test a lot of things, but then ultimately we want to influence national level strategy. And we, I guess, recognize that if we're not telling the true story of our communities, we're really failing them, and we'll make worse policy. So I guess this is the things that we really wanted to avoid and wanted to do, is that we wanted to embed community voice at the core. We really wanted to shift the power between researchers and community organizations and young people. I think when we spoke to community orgs and young people, they felt that the power really was with the researchers who were asking the questions, and not with them who, were ostensibly trying to serve. So we wanted to make sure the research served the young people and made some change. And we also recognize that often our research commissions, when we looked across them, they tend to go to larger organizations with bid writing teams, and that kind of crowds out the opportunity for smaller community grassroots researchers to get a chance. So we wanted to kind of look at our commissioning process. So I guess the way we did this is we built a team, and first trying to think about the expertise we needed. So we wanted to bring in, I guess, myself and my colleague Ellie are from the policy side, but we wanted to bring in academia, but also frontline practice. So we recruited Rebecca Stanley. She is the NHS operational lead at New and Wellbeing Action for Youth, which is a London vanguard service working directly with youth and families impacted by violence. She's also a member of our Youth Practitioners Advisory Board, and was able to bring that kind of key frontline insights and challenges when we were developing the specification and the research project. And then we also recruited and consulted with Luke, who is a practitioner, but also an academic. So he has written extensively on violence reduction. He works at the Open University, but is also a youth worker and works at Hackney Quest. So they were both really influential in being able to shape not only the actual research project, the questions we were going to ask, but also how to change the process to make sure that we were thinking about the power dynamics from the get-go and how we choose the researchers. And essentially the procurement process for this project ended up looking like this. So usually we have a pot of money, we give it to some researchers, and then they are the ones who go out and build a collaboration with a community organization or find participants. We decided to flip the way we did this, and we went out with a specific pot of money to the community partner themselves, and then we recruited them. We got and they helped us to develop the specification for the researchers and also to choose that researcher as well. So they sat on our panel, as did a member of their youth advisory board, to help us pick that research partner. They also have their own kind of pot of money, which means that they're able to decide how they create incentives for young people to participate in the project. And then we procured then we procured the research partner. We also focused on quality rather than the price of bids, which we think will help smaller organizations to bid and not get crowded out for those who could kind of undercut the price. And we also really tried to minimize the burden on the smaller organizations for bidding by making the criteria super clear, but also the questions a lot shorter than they usually are in our research commissions. The other thing we did is that we know that the VRU is just one small funder in the drop of an ocean that is London and the ocean that is the UK. So we were really keen that the effects of this project was not just for this particular research pot of money. We wanted to think about how we could build the research ecosystem in the violence reduction space in London to encourage more collaboration between grassroots organizations, to kind of name those power dynamics and the different incentives from the research side and the grassroots side. So we held this kind of networking event. We decided to host it in a community venue to really center grassroots voices. We had this really honest discussion that Luke facilitated about the good and the harms of research, and I was kind of trying to build this area of commonality. And there was a lot of harms discussed, but a lot of good discussed, and ultimately kind of bridging the gap in terms of both the researchers and the frontline practitioners. We also similarly, thinking about commonality, discussed like why we do this research, and ultimately found a lot of commonality between both sides. And then there was also a lot of time for like speed networking. So we hope that following this event, there will be more collaborations between research and kind of that frontline grassroots insight. We really focused, I won't go through all of this, but we focused on kind of embedding that power sharing in the contract so that the community organization and the young people have influence over all of the decisions about the research, and really trying to embed those principles: culturally competent, trauma-informed, transparency, but ultimately trying to make sure that it's not extractive and not harmful. In terms of my outputs and next steps, and also just please stop me if I've gone over time, we've written a blog post kind of reflecting on that event, which is on the LRaPP website, and we can share here. There was a lot of back and forth to develop this commissioning process, so we are developing it into a case study for others who might want to try and replicate this approach. And then we'll have another blog post where we're going to interview Sami, who's the head of Wipers, our community organization, to understand his experience of the whole thing as well. In terms of the key takeaways, very quickly, I think just doing things differently requires a lot of resilience and commitment, and a lot more red tape and time and resources, and hard to keep the energy to keep doing that. But I think it's really great when you have other people on board to hold you accountable, which is like the benefits of that collaboration. I think the frontline practice input from the design stage was incredibly useful. There was just such practical things that we didn't think about in terms of delivering some of this research. And also just being prepared to change course. I think there was lots of feedback that we didn't anticipate from practitioners, from communities, and from young people. And having to build in that flexibility takes time, but ultimately, I think, hopefully we'll build better evidence. This is just to say that we're trying to continue the momentum. We're running a few other network meetings because there was so much interest from both researchers and grassroots organizations to continue that conversation, and I'll share the Eventbrite link to that. And also looking into like studentships and funding PhDs within the VRU to try and encourage this momentum. But yeah, that's how the project's gone so far.